Panic disorder is a condition characterized by a strong anxiety crisis that triggers a series of physical and emotional symptoms, along with a profound sense of fear and despair. These episodes can occur at any time or place randomly, multiple times in the same day, or they can take weeks, months, or even years to reoccur. Panic episodes may last for minutes, but each person experiences them differently, and even though the crisis is brief, the sensation is that of hours passing, depending on the severity. The fear generated by panic attacks can significantly impact the quality of life for individuals dealing with this issue. Understanding what happens during the crisis and measures to improve self-control can be very helpful for everyone.
We also know the impact of social media in our lives, and they can significantly affect individuals with panic disorder, as well as those with other anxiety disorders. Here are some ways in which social media can affect people with panic disorder. Triggering content. Social media platforms can expose individuals to triggering content, such as news about traumatic events, violence, or disturbing images. Exposure to this content can raise anxiety levels and potentially trigger panic attacks.
Fear of missing out. FOMO. Social media often showcase the activities and experiences of others, leading to feelings of missing out on fun or exciting events. For individuals with panic disorder, this fear of missing out can lead to intensified anxiety and a sense of social isolation. Comparison and self-esteem. Social media can fuel social comparisons, where individuals with panic disorder might compare themselves to others and feel inadequate or inferior. This can negatively impact self-esteem and contribute to anxiety.
Stimulus overload and information overload. Constant exposure to social media and the influx of information can be overwhelming and lead to increased stress and anxiety, especially for individuals with panic disorder. Cyberbullying and negative interactions. Experiencing or witnessing negative interactions on social media, such as cyberbullying or online harassment, can significantly impact mental health and raise anxiety levels. Misinformation. Social media can be a source of misinformation, including inaccurate or sensationalized information about anxiety or panic attacks. This type of content can cause unnecessary worry and fear.
It's important to highlight that if the symptoms of a panic attack occur repeatedly, the individual should seek a psychiatrist to confirm if the diagnosis is indeed panic disorder. If this is the case, treatment will begin, and medications can greatly help reduce the frequency of the attacks. Over time, they might not occur again. However, at the beginning of treatment, while the medications are still taking effect, it's common for patients to experience some attacks. So, here are some tips.
1. Keep in mind that panic attacks are time-limited and the peak of symptoms lasts for 10 to 20 minutes. Symptoms start suddenly, escalate to a peak, and then gradually subside until they pass. It might feel like an eternity, but after a few minutes, these symptoms always subside, no matter how intense they are. It might seem like you're about to die, but nobody dies from a panic attack. Just knowing this and realizing that it will pass soon can restore a bit of self-control in dealing with the situation. 2. One of the symptoms of panic is the sensation of shortness of breath, which leads to rapid breathing, known as hyperventilation. This worsens the symptoms, so it's crucial to control your breath by taking deep inhales and exhales.
3. Focus your attention on something. It could be an object, a texture, a familiar scent, or even your own breathing. The idea is to divert your focus away from the physical symptoms and intrusive thoughts. 4. Another alternative is to imagine that you are in a place that brings you happiness and calmness. Visualize this place in your mind, describing the colors, shapes, smells, and so on, as if you were explaining it to someone else. 5. During the crisis, there's a tendency to tense up your muscles. Try to observe this and use techniques to relax your muscles, like stretching, for example. Each person will find a technique that resonates with them the most. The important thing is to always remember that this is temporary and, most importantly, that there is treatment available.
Did you find this video informative? If you have any tips about your journey with understanding panic disorder, effects of social media and strategies for coping, share with us and leave them in the comments below. Thank you for watching the video, subscribe to the channel, and give it a thumbs up. Goodbye.